We're going to be hearing Senate Bill 1 this morning and opening the hearing on Senate Bill 1. Just a little bit of introductory comments. We are hearing this bill for the second time. Well, we're hearing this issue for the second time. We took extensive testimony on the House bill. This one is quite similar. If you testified at the last one and you've got something new to say, we'd love to hear it. If you testified at the last hearing and you feel compelled to repeat yourself, we haven't forgotten what you said. So I don't think repetition is necessary. Without a lot of repetition, with emphasis on the differences between the bills, we welcome everyone here to testify and participate. With that, I'd call Senator Dan Lavers. Prime sponsor. In favor of the bill.
That's correct. Thank you very much, Mr. Chairman, members of the committee. For the record, Dan Phelps, Senate District 15. Honored to represent Concord, Hopkinton, Henniker, Warren, Pennacook in the state Senate and be before your committee once again to talk about this very important public policy matter for our state, our people, and our businesses. And that's correct, Mr. Chairman. I'm here in support of Senate Bill 1 relative to paid family and medical leave. First and foremost, I want to just thank, there's been a lot of years of work on this piece of legislation. I want to thank, in particular, one of the lead advocates over the years, former Representative Mary Stewart-Geil, who's here today, for all her leadership and work on this. It wouldn't be at where it's at today without her work on it and her persistence over many, many years. I want to thank members of this committee, Democrats and Republicans. I want to thank all the stakeholders and members of the public who have participated in hearing after hearing after hearing after hearing after hearing over many years of work on this. And Mr. Chairman, I want to thank you for your graciousness. Thank you for your work on this, and all the committee members for hearing this out. A lot of work over many years. It's time to finally move forward with paid family and medical leave insurance to help working families and small businesses struggling to get ahead and stay ahead. Mr. Chairman, members of the committee, New Hampshire faces a number of challenges. And there are many different ways to approach those challenges. Paid family and medical leave insurance helps us address some key challenges our state faces. One, we have a caretaking crisis. And each year, and you'll hear the numbers perhaps from AARP, but $2.3 billion in unpaid work caretaking evaluation in New Hampshire. These are folks, these are workers who are taking time to caretake for an ailing parent, an ailing senior, making sure that they get the care they need, struggling to balance work with family. That's what paid family medical leave insurance is all about. We all value work, we value family, we should value the proposition you shouldn't have to choose between the two if at all possible. And having wage replacement insurance when you're caretaking for an ailing parent or perhaps your spouse who may be in hospice, that's time you don't get back. To have wage replacement insurance to allow you to spend time with a new child that you've adopted or biological, that's time you don't get back. And that's time that's critical for the emotional and social development of that child. It's critical for health outcomes. It's critical for family unity. It's critical for the value of family, Mr. Chairman. And combating our opioid epidemic. You know, we got workers' comp, which is work-related illness or injury. We don't have wage replacement insurance in the state that's affordable and accessible for situations that are non-work related. For example, if you're a worker and you need to get into an intensive inpatient drug treatment program, one of the number one reasons cited why people don't do that in New Hampshire is because they don't want to risk their family's economic security by taking those 30 days plus away from work without pay. Having wage replacement insurance, paid family medical leave insurance, will enable people to finally get the treatment they need. That's good for them, That's good for their employer. That's good for our economy. And Mr. Chairman, small businesses are incurring the costs right now. People take leaves. But in terms of access to wage replacement insurance and paid family medical leave insurance, our small businesses don't have access. In some cases, bigger businesses do, but small businesses don't have access to this insurance. That means two things. One, small businesses are at a competitive disadvantage in terms of attracting the kind of workforce of tomorrow when bigger businesses are able to provide for paid family leave. It's something young, working families want. And if we're talking about being in competition with Massachusetts for workforce, which most economists say we're in a big competition with, there's a lot of different ways to look at how we're in competition for Massachusetts, but one of the ways that we're in competition is in terms of family-friendly practices that working families and young workers are looking at. And Massachusetts, Mr. Chairman, just went forward with paid family and medical leave insurance under the leadership of Governor Charlie Baker. We're looking at Maine probably going forward and Vermont going forward as well. New Hampshire cannot, in terms of workforce development, afford to be on an island not having paid family and medical leave insurance. And in terms of small businesses incurring those costs without a mechanism for worker retention. We know that if a worker has access to paid family and medical leave insurance, they're 4 or 5-fold more likely to return to work because they have a stabilization factor in their life during the time of a critical need for them and their family, maybe their kids. That stabilizes them, it gets them back to work, that helps small businesses retain the workforce that they have. And again, we are seeing a break point between small businesses and big businesses in terms of access to paid leave. Paid family medical leave insurance should be available, accessible, and affordable to all working families in small businesses in the Granite State. And we need to levelize the playing field between small businesses and big businesses on this issue. Mr. Chairman, that's exactly what Senate Bill 1 does. Senate Bill 1 is the product of, as I mentioned, years of work. There's an actuarial study that was funded by the United States Department of Labor, which serves as the basis for the numbers in the bill. There's also a function of plenty of input by stakeholders and by the business community. Let me just walk through some of the provisions, and I'm happy to take any questions, Mr. Chairman. First and foremost, as a function of input from the business community, all this operates as an addendum to unemployment insurance. Businesses have more flexibility than they have under unemployment insurance. Businesses under this bill can either self-insure, provide the benefits on their own, join with another business to provide those benefits, or some combination thereof. So they have the option of doing this on their own, with other businesses, on the open market. Certainly some businesses will exercise that option. Other businesses may make a business choice to be part of the addendum to unemployment insurance. If they do, they have further options and flexibility. Businesses can pay the insurance premiums on behalf of their workers, or they can do a payroll deduction to pay the insurance premium, or some combination thereof. So while this is an addendum to unemployment insurance, you can see it has way more flexibility than unemployment insurance and how it operates. On top of that, if you look at page 3, line 24 through 27, Mr. Chairman, members of the committee, you'll see that we've included a provision, and I believe this provision's in the House version too, I believe, that an employer may require that leave taken under this chapter be taken concurrently or otherwise coordinated with leave that the employer has under the terms of a CBA or in the employer policy. In other words, if you have a policy that requires vacation be taken first, that can offset or be taken concurrently. You just have to put it in your policy as an employer, or it's part of the CBA, it's part of the negotiating process. In addition, if you flip to page 4, lines 12 through 15, contrary to some of the information out there, there's nothing in this chapter that diminishes an employer's obligation with a collective bargaining agreement or employer policy, nor does this chapter, I want to make this very clear, or any decision of the commissioner limit the ability of employers to provide family and medical leave insurance benefits above and beyond what's in this chapter. In other words, Mr. Chairman, members of the committee, Senate Bill 1 is a floor. It's not a ceiling. If employers want to do more, they can do more. Some employers might. They might say, well, you know what? We do 15, 16 weeks of paid leave, work for us. If they want to, that's fine. It's clear under this provision that they can and that they have the allowance to do so. If you flip forward to page 5, lines 5 through 13. Contrary to some suggestions out there, this is a public-private partnership. It's a public-private partnership. It requires that employment security go out on an RFP for both the fund administration and the claims processing of this unemployment insurance addendum, paid family and medical leave insurance. So, but it says no third-party administrator can get that contract unless it demonstrates that it can do it at least cost in the state to protect the state's financial interests and to protect the solvency of the program, number one. And number two, that the third-party administrator who's bidding has to show that they're going to comply with the statute, including the timely processing of paid family and medical leave insurance claims. That's important for our business community. It's important for claimants that there's a demonstration by a potential third-party administrator that they will comply with the provisions of this chapter. One of the things that you may know, Mr. Chairman, in terms of a difference between this bill and the House bill, I think the key difference is the so-called job protection piece. And so let me touch on that, and that's on page 3, line 17. So, just taking existing law under the Family and Medical Leave Act, under the Federal Family and Medical Leave Act, for qualifying leaves, employees can take unpaid leave, and that they are entitled, this is the job protection piece, entitled to either their job back or a substantially equivalent position. Those are the words. And there's been a lot of case law and rules and regulation about what is a substantially equivalent position. I want to be clear that under FMLA, nothing requires employers to physically keep the job open. They can hire a temp worker. They can reassign tasks to fill those responsibilities of the employee on the leave. And even if there may be a substantially equivalent position, there's also a undue financial burden exception to that job protection piece. So that's existing law. 50 or more employees, that job protection piece is there, and that's how it operates. And again, there's a lot of case law and, as you might expect, Mr. Chairman, debate about what is a substantially equivalent. But it's all built out, and it's there. Senate Bill 1 says, all right, we're going to use existing law in terms of substantially equivalent position, all of that stuff. But the job protection piece goes down from 50 to 20. So if you're an employer of 20 or more employees, then that job protection piece operates. Here's the argument for it. The argument for it is that some employees may not feel comfortable taking a leave if they may not get their job back or a substantially equivalent position, especially employees in low-wage jobs. So if we want to make this truly work and work for working families and work for all working families, including vulnerable low-income working families, well then the argument is you put a job protection piece into the bill. The counter argument, which you may hear, is, well, this is going to be a burden potentially with respect to how businesses operate. And that's why I prefaced all of this by saying existing law, it's not that you have to keep the exact position open, it's substantially equivalent position, restoration, and there's an undue financial burden exception. And that will go down to 20. But even notwithstanding that, Mr. Chairman, we've set the small business exception at 20. Initially filed it, we had it at 15. In the Senate, based on input at the hearing, we bumped it up to 20. I think some in the business community thought that was a more reasonable mark. So this bill, the key difference, I think there's some other editorial differences, but the key substantive difference between Senate Bill 1 and Representative Wallner's bill is the job protection piece, which is in this bill but not in Representative Wallner's, and it goes to 20 employees. Just in conclusion, I mean, there's a lot of stuff that we work on up here where, you know, at the end of the day, you're like, are we going to make a difference? Are we really going to help people? I'm telling you, Mr. Chairman, if we pass this bill, we are really going to help working families and small businesses across the state. So let's get it done. Let's move it forward. Really appreciate the opportunity to be here. Thank you, Mr. Chairman. Happy to answer any questions.
Thank you. Questions for the Senator?
Thank you, Mr. Chairman, and thank you, Senator, for introducing this bill to our committee. As you talked about, the Senate had worked on the reduction of the FMLA requirement from 50 to 20, and you mentioned it was originally a 15. In your talking about it, did you get any estimate of the total cost to businesses for extending that requirement down to smaller companies?
Thank you very much for the question, Representative Seaworth. So there are plenty of studies about job protection that can forward to the committee afterwards, and there may be people behind me who will talk about that. But basically, those studies center on, well, what is the cost of, you know, dealing with a temporary leave, and then what's the benefit of the worker retention, as I talked about earlier. So, you know, you, like I said, 4 or 5-fold more likely to have an employee return with paid leave, and so the question is, you know, there's benefits and there's costs, and so I don't have a clear answer for you. There's studies on it, but maybe somebody behind me actually has the studies with them. I don't have them with me. I'd be happy to forward them to the committee.
Thank you, Mr. Chairman and Senator. It's always good to see you. Page 2, line 23, roughly. Political subdivision of the state may opt into this chapter upon certification by the authorized representatives, so on and so on. So, if they don't certify or they don't negotiate in a collective bargaining agreement, is that a violation of the 14th Amendment? Equal representation under the law?
In terms of
This law.
Okay, well, let me try to follow your, thank you very much, Representative. So, as I understand, maybe the 14th Amendment argument from Representative Flanagan, it's with respect to people represented and not represented, is that right?
Basically, yeah, or
Okay.
better yet, the law says one thing, but it doesn't affect all people. It only affects a certain group of people. In this case, we're dealing with a 28A issue to try to get around that, but we're violating the 14th Amendment of the U.S. Constitution.
I appreciate that. So, I think the answer to that is there could be an equal protection argument if we did not provide an avenue for everyone to get in. And if you look at line 28 and 29, it says employees not covered by a CBA in a political subdivision of the state may opt into this chapter. And so there's an avenue. There's also an avenue for, as I may have mentioned earlier, this is closely aligned to unemployment insurance, so it adopts a lot of the definitions. So there's also an avenue for self-employed to opt in as well. So there is an avenue for everyone to get in. And because of that, I don't think there's an equal protection problem, but I appreciate the
Follow
question.
up. Quickly, the back to be similar to this. So basically, you're giving one group of people the ability to get out of it now, but all the other people not to get out of it.
Representative, we're giving everybody an avenue to get in.
Thank you. Other questions? Mr. Mackey?
Thank you, Mr. Chairman. Thank you, Senator. Page 3, under beginning line 29, on the eligibility requirements, it would appear that a large number of people working some jobs and also people working part-time jobs who would not meet the hours or the number of months worked would not be eligible to receive these benefits. Is there a reason why they would not be able to opt out of this? Since they have no chance of receiving benefits, why should they be paying the income tax?
Thank you, Representative McKay. This is an addendum to unemployment insurance. And like unemployment insurance, we link it up to base period and alternative base period. Those terms are defined in 282A2, which means whether it's seasonal or not, there's plenty of flexibility for the 6-month pay-in to get into the system and qualify. So you gotta have some skin in the game, I think. It's an earned benefit. And this is a fairly flexible and low bar to address actually seasonal employment. Part of the reason we did this the way we did it is to help allow part-time workers and seasonal employment the opportunity to get in. So I think this has greater flexibility with respect to part-time workers and seasonal workers than even some other definitions around the country. That being said, again, there's got to be some pay-in, some skin in the game, so to speak. So there's a 6-month pay-in, but it can be within the base period or alternative base period. So that's the last 12 months look back. Alternative base period is the first 4 calendar quarters of the last 5 calendar quarters. That's how it works in unemployment insurance. And there's a lot of flexibility of when the pay-in occurs. But we do want to make sure that there is a pay-in and that there is skin in the game.
Follow-up? Thank you. I guess the skin in the game I see them giving is their pay, but someone who works just 3 months or 2 months even in the summer, 14, 15, 16, 17-year-old, is never going to work enough to get paid. They can't take the leave. They haven't worked enough months to do it, yet they're still playing their skin in the game with no chance of ever getting the money. Why should they just not be exempt?
Thank you for the question. So, like unemployment insurance, workers, employers, there is pay-in and there's requirements of hours worked. And so this dovetails off of unemployment insurance in terms of those definitions. If conceivably there's a high school student that works 3 months, some summer, and then works, a couple months during the winter or whatever, they can end up in a position where they might be eligible for it down the road. But this is a pretty flexible definition of eligibility.
Scale?
Thank you, Mr. Chairman. Thank you, Senator. There are a lot of situations where there isn't really a choice, where the worker has nowhere to turn but to themselves, and does the employer then just replace them when some crisis happens? Is that what happens now?
Thank you for the question, Representative Cahill. I think it depends on the business and depends on the requirements. So certainly, if we're going to the job protection piece, if you're an employer of less than 50 employees, you are not required to restore that person after a qualifying leave to their position or a substantially equivalent position. So what happens sometimes is that job is filled. If you're less than 50 employees, that job can be filled. And there's no substantially equivalent position open without a job protection piece. And then the person may not have a job to go back to, which is why it's kind of the question that kind of leads to the argument about why you would want potentially a job protection piece, because you want people to have that economic security and peace of mind that following their leave, many of these leaves are not voluntary. These are things that happen in people's lives. And following that leave, the person has a job to return to. So I don't have the numbers of what exactly, how many employers of employees less than 50 just wholesale say, we're not gonna hold it open for you, versus how many do, versus how many else make accommodations. I think the overwhelming majority of businesses in New Hampshire work their level best to try to help people and try to work with the workers. But some are in tough spots, especially small businesses. Especially small businesses that don't have the access to paid family and medical leave insurance, because we know that worker with stability in their lives is 4 or 5 times more likely to return to that job. And if you're a small business and you train that person up, you're gonna wanna get them back after the leave. And so, having the access, both the job protection piece for the peace of mind, so people have that economic security, but also the wage replacement insurance, I think functions together to help in most situations.
Thank you. Senator. Yeah, I'm thinking of a family in my district in Newmark with a 10-year-old son who's in need of a kidney transplant. He was in Boston Children's for a couple of months, and now he goes back there 3 days a week for dialysis. And the employers, the couple's employers have been very good to them, and fortunately, not all are, but many are. And of course, the community has responded, and things, meal trains and donations. But wage replacement would be something that would be helpful to all of our workers, wouldn't it?
Yes, and in fact, I think if you look at the definitions of qualifying leave and family member, that particular type of situation, if you had a kid that's getting that kind of treatment, that would be a qualifying condition under this chapter, and it would help that family stay afloat in a tough time. You'll probably hear testimony, you probably already heard testimony about what that would mean to working families to be able to have some wage replacement insurance at those moments. It's not just in situations where you may be caretaking for a child or a parent, but also, let's say that you are diagnosed with cancer, and you have, every other week you're going into chemo. Having some wage replacement insurance in those situations, so that you, with your illness, and you may be the primary breadwinner in your household, you may have kids, have some wage replacement to keep your family afloat. It's not going to solve all the problems, but like workers' comp insurance, like unemployment insurance, insuring for those life events that are critical, and so that people don't have to choose between work and family. I think that's something we all believe in, and hopefully that's something we can move forward in.
Thank you, Senator.
Got a question. We've heard talk about the benefits of wage replacement to the employees, and certainly it provides that support. Is there a benefit to the employer in the wage replacement? And if so, how would that work?
Yes, I think that, there's plenty of studies about how that insurance helps employers too, Mr. Chairman, and I mentioned some of them earlier. If you have an employee that takes a leave, if they have wage replacement insurance, they're much, much more likely, because they have economic stability in their lives, to actually return to work. And there's plenty of studies about how, and you may hear from people behind me, people sometimes leave the labor market after potentially having a kid or caretaking for a senior, caretaking for a parent, and without the access to wage replacement insurance. So it keeps, it does two things. A, it keeps that attachment to the job and to the labor market, and B, to make it more likely to return, and B, it keeps that economic stability in the household. And when you're in a stable household situation, you're more likely to return to your job, rather than scrambling to figure out how to keep your family afloat. It helps in terms of worker retention those ways. It helps in terms of worker productivity too. I think there's a lot of studies from other states about worker productivity, and a lot of the states that move forward with paid family and medical leave insurance, some business groups that were initially in opposition have come around because it ends up providing a benefit in worker productivity or worker retention. Lastly, I would add this, especially with respect to small businesses. We're in a tight labor market. Businesses are competing with each other, and we're competing with other states on attracting and retaining the workforce of tomorrow. In terms of businesses in New Hampshire having access to a real plan that's affordable and accessible so that our businesses can attract the workforce of tomorrow, we're going to be left behind if we don't take action. That's number one. Number two is in terms of our small businesses in particular. They don't have the overhead and the kind of cash flow in the pool to be able to provide this typically on their own. And the companies that offer some minimal, very minimal, temporary disability insurance on the private market, and it's very, very minimal in terms of duration and in terms of the benefit, they're often cream skimming or going after the bigger businesses. So if you're a small business and you want to be able to provide this so that you can say, all right, work for us, we have paid family and medical leave insurance. Right now, small businesses, including in New Hampshire, are at a competitive disadvantage with much larger businesses who are able to do this on their own. And that's not fair to our small business community, which is the backbone of our economy, that they don't have access to an affordable, accessible, paid leave insurance plan. So I would say it's threefold. It's worker retention, worker productivity, and attracting and retaining the workforce of tomorrow are the benefits for the business community principally.
We heard a lot about the generosity of employers in New Hampshire and how some employers actually go above and beyond and they cover lost wages while an employee is out for any one of these reasons. Wouldn't it also benefit those employers because instead of them having to cover the cost of those lost wages, the insurance covers it?
Yes, depending on, that's absolutely right, Mr. Chairman. Depending on what the employer does, this will defray some of those costs for the employer. If an employer does do, Mr. Chairman, as you remarked upon, and a lot of businesses do, help defray some of those costs so they can retain their worker, this will defray the employer's defraying of those costs. It will help employers under those situations. So I think that you'll also see with the flexibility that's built into this bill, Mr. Chairman, that some employers that are providing this potentially on their own, given that we're operating as an addendum to unemployment insurance and the costs are low and it's affordable and accessible across the board, a lot of businesses will take the business option to be part of the unemployment insurance addendum rather than making the choice of self-insuring or going on the market. So this will reduce costs also for those employers who make the decision that they want to go with a more affordable, accessible plan for those employers that are providing it right now.
Other questions? Mr. Bordy.
Thank you, Mr. Chairman. Thank you for taking my question, Senator. On page 1, line 24, there's a definition of family members, and I just want to make sure I understand. It mentions, son, daughter, etc., and then by marriage. So does that mean a son-in-law or a father-in-law or a mother-in-law? Would they be considered a family member or not?
Just reread that. Thank you, Representative. Family member means a spouse, domestic partner under RSA 457. I don't have RSA 457 in front of me. Son, daughter, parent, step-parent. No, I don't think it covers.
In-laws, you don't
I
believe
don't think it covers, but it would cover obviously the person who's direct relation. So
Thanks, Mr. Chairman. Thanks, Senator. Good seeing you.
Good to see you too.
Just out of curiosity, in your professional opinion, and I apologize if the chairman gavels me on this question, but if we didn't feel there was a need for some sort of plan, whether it be private sector or public sector, do you believe the governor would have some sort of plan in his budget?
Thank you for the question, Representative Susi. I'm not in the governor's head, so I don't know why he's made the choices that he has made. I can tell you this much, though. What the need is for a real plan that's affordable and accessible for all working families and small businesses. I haven't seen, I understand it might be an HB2. I don't think we've seen HB2 yet, so we don't have an opportunity to really evaluate it. But at the end of the day, we need something that's affordable and accessible. And I think when we talk about the concept of public-private partnership, that's in this bill. It is a public-private partnership. When we talk about maximizing the private sector, that's in this bill. Businesses have the option to do that. When we talk about making it affordable and accessible, that's what this is designed upon. In fact, there's an actuarial study that serves as underpinning this. I understand, based on what the Department of Admin Services did with respect to whatever plan might be in HB2, that they issued a request for information, and that there was just some responses that were pretty marginal in response to the request for information. Representative, we've been requesting information on this bill for decades. We've been working on it for decades. And the information is in, the studies are done, the work is complete. It's time to finally move forward with paid family medical leave insurance. Working families and small businesses have been waiting way too long. And we've had hearing after hearing after hearing after hearing after hearing. And it's time to finally move forward. This has been what's worked on. Democrats, Republicans, business community, stakeholders. It's time to go. I respectfully encourage this committee to vote favorably on Senate Bill 1.
Sounds like a conclusion to me. So with that, thank you for your testimony.
Thank you very much, Mr. Chairman. Thank you.
And next, I'd like to call former Representative Mary Stewart.
Thank you, Mr. Chairman. Good morning.
Morning.
And good morning, members of the Labor and Rehabilitation Services Committee. It's nice to be here. I want to especially thank you, Mr. Chairman, for recognizing me when you heard House Bill 721. I was not well that day. Imagine, I had to go home and recover from a 21-day cruise on the Caribbean.
My heart goes out to you.
But I have since recovered almost, and so I wanted very much to be here this morning. I am a former representative, having served in the legislature for 22 consecutive years, representing most recently Merrimack 27, which is everything west of the Merrimack River except Ward 5. But I am still currently a resident of Concord, and I wish to speak in support of Senate Bill 1. I'm going to tell you why, very briefly, I have stuck with this. And then, secondly, I am passing out the chronology. And if you've already seen it, I won't belabor it. I just will hit the highlights that I think are important for you to know, to be an informed voter on this particular policy. I decided in 1996, when I ran for the legislature, there were two major reasons. One, I was an early childhood specialist, so I wanted to continue my advocacy for families with very young children, birth to age 8. Secondly, I ran because I wanted to introduce a policy on paid family leave. The reasons for this was I am a mother. I had 2 children in Montreal, Canada, where I had not only had the benefit of a paid family leave, but also a baby bonus that started arriving shortly after the babies were born. But then I moved to New Hampshire and had a 3rd child here. And as a state employee, I was given the privilege of 4 months of leave. That was an accumulation of my annual, my compensatory, and sick leave. And every effort was made to support me in the earliest months of mothering this child. However, and I came back to work. The child was born in November, came back to work in March. However, I noticed when the secretaries in the secretary pool, we had one at that time, who were much younger than I was, were starting their families. They were not privileged to take their annual and compensatory. They could take their sick leave. But there was a very different policy that applied to them. And I was upset about that. I felt very guilty having had the 4 months, and I thought something's got to happen here at some point. So that was my first reason for really sticking with this, to try to make it more equitable among employees in the State Department of Education at that time. The second reason I am very involved with very committed to paid family leave is because I did a doctoral study at Vanderbilt University, and it chose as my focus the earliest human attachment. And I was convinced, after 3.5 years of study and research and talking to people like Barry Brazelton and Mary Ainsworth, top people in the field, that the first years, the first months and the first years of human life are critical to the healthy development of that individual throughout the lifespan. Not only as it relates to learning, not only as it relates to the development of competence, not only, but also as it relates to the ongoing ability of that individual to develop positive relationships within the family as well as to the community. So that was the second reason. The third reason that I decided to submit this bill is I retired early to care for my aging mom. She had Parkinson's disease, she'd been living in California, she came to live with me in New Hampshire, and it became very clear that there were not the services that were available to provide home care, and she was living with me, were not consistent. And so I decided to take early retirement from my position, which I love, which was chairman of the early childhood department at NHGI, which is Conference Community College. So those were the 3 reasons, and I share that with you just to say that's what has been driving me for 20 years. Now, the chronology that I circulated is to give you the actual information that has been the basis of this bill. And my first question has to be, have you seen this document before?
I have not.
Well, then I'm just going to hit it briefly. All right, I want you to notice that in the year 2000 we began, and at that point in time, the Unemployment Insurance Trust Fund was in the hundreds of millions of dollars. And so Baby UI became the source of funding for many states to start a policy of paid family leave. Unfortunately, what we had thought we would do is borrow some of the trust fund money to start the paid family leave program and then pay it back as the income. Well, of course, Gary Daniels was the chairman of the labor bill at that point in time, and he said we really need a feasibility study on this. So you can see that's what came next. Then our bill caught the attention of the National Partnership of Women and Families, and we were assigned a graduate student from the Kennedy School of Government who got permission from her professor to do a major study on the feasibility and the cost of implementing a paid family leave in New Hampshire. She did a very extensive study. It enabled her to get her master's degree. At the same time, we had Cheryl Cordes from the New Hampshire Department of Insurance, who did a study for us looking at temporary disability insurance. We were trying to explore as many options as we could. We came up with the idea of submitting a bill to create a temporary disability long-term, which was 26 weeks, and to embed paid family leave into the temporary disability insurance. That didn't work either. So then we decided, after having submitted 3 bills, we needed to back off and find out what kind of support was there in New Hampshire. And at that point, I introduced a bill called the Task Force on Work and Family, the basic purpose of which was to look at employment policies and practices of businesses in New Hampshire. The task force, for those of you that are new, is very similar to a commission. It is a little broader than a legislative study committee. The task force that we proposed had 25 members. We included everybody. We included business, we included academia, we included parents, we included nonprofits. And it was a wonderful experience. It began as a chapter law, and it was put into the RSAs and continues to be in the RSAs at this point. The task force then embarked on gathering information. And you can see at the bottom of the page, we held summits. We invited people from all over the state to come to meetings here in Concord. We invited speakers from national, and they gave us lots of research, not only what was going on in the United States, but also what was going on nationally. So they were very comprehensive. The task force also divided into teams and went around the state. We held meetings, and well, you can see Manchester, Portsmouth, Claremont, Laconia, Gorham, and Concord. We published the first study on New Hampshire working families, trying to figure out what do New Hampshire working families need. We began to work on House Bill 661, and as you can see at the top of the next page, in 2010 we decided to start communicating more with the Department of Employment Security. Every year, every 3 years, they were publishing at that time, I don't know if they still do, a booklet on the vital and employment statistics. And we decided, the task force members voted to ask them if they would put paid family leave into the section at the end where they asked all business people, what kind of benefits are you offering your employees? We wanted to get the status quo, and we also wanted to introduce it, provide a baseline for the committee. 2009, we introduced House Bill 661. That was a bill that was studied by the Insurance Committee. They retained it, they submitted. They decided to put it to interim study, and that was the committee that said, you have to do a feasibility and actuarial study. Well, here we were, a legislative task force. You know how well endowed any of the commissions are, as far as money is concerned. So we started to look for money, and we said, first, go back to the Department of Insurance and see if anyone there will do the actuarial study. Sorry, we can't do it, we don't have enough funds. Then we went to labor, then we went to the Employment Security, we went to Health and Human Services, we went to the Charitable Foundation. We were trying to find some funding because a real actuarial study is going to be a costly endeavor. We had somebody that we thought could do it. Fortunately, in 2014, Department of Labor put out an RFP. We were not qualified to apply that year, but we did anyway, and our proposal was denied. The second year, we applied, and we were given $173,000. That is the funds that were granted to the Department of Employment Security, which they accepted and then contracted to the Carsey Institute of Social Policy to do the feasibility study. That took a whole year to do, and the Carsey Center was in touch with people in Washington, all of the think tanks that are working in this area, and they eventually got the study done, and that study became the basis for House Bill 628. And those of you that were here last year know 628 was supported by the House, having gone through 3 committees, and then didn't make it again through the Senate. So here we are again with Senate Bill 1 and House Bill 721. I really, really feel that this policy has been studied. I think this particular sheet will inform you as a legislator of all of the work that has gone on by multiple people, hundreds of people who have gotten behind this bill over the years. You know that you've heard in previous testimony, over 82% of New Hampshire voters support paid family leave. You know there is strong support in businesses. The research nationally is very, very impressive. And I just wanted to share this with you because some of the discussion that I've read in the paper that occurred in the Senate was that we need another actuarial study. We do not need any more studies on this bill. And last year, we stress tested all of the levels of participation in a policy of this type. It's ready to be passed, and I hope you will do it. I hope you will do it because it's an incredible benefit to families with young children, with families who have problems. Life happens, we all know that. It, I think, will help New Hampshire in our workforce development initiative and certainly in long-term the economy of our state. I also feel that it will be particularly helpful to military families. This isn't mentioned in the legislation, but I know military families who, when the husband, wife, son, or daughter come back from deployment in the Middle East, there is a time when the parent, when there needs to be family together to help that young man or young woman or elder man integrate back into the family. So I think that this will be a wonderful bill to pass, and I hope you will vote to support it. And I'd be happy to answer any questions, although I've probably taken up too much of your time. Thank you.
Been lovely to have you here. Questions for Representative Seaver?
Thank you, Mr. Chairman, and thank you, Representative, for returning to our committee. I was curious as you went through the history, the version that actually passed the House, that was in HB 628. It's anecdotal, but people told me one of the reasons for the broad support is it actually gave individual employees the option to participate in the program or to choose not to. Do you know the reason why that was changed into a mandate for all employees, all except the political subdivision?
Well, we want to get as many people involved. The opt-out that was proposed by the Labor Committee in 2017 was a one-time opt-out. And one of the reasons the sponsor agreed to go with that was because we felt it is reasonable to assume that someone graduating from college and starting to work at BAE Systems or some place might not understand the need for a paid family leave benefit in their as they are an employee. However, we understood that, the one-time opt-out. However, we also created in the legislation that any January, anyone who had opted out initially could opt back in. But once they were in forever. And they were in even if they went from BAE system to Fidelity, because there is a portability clause in House Bill 628. If they went out of state, that would be another thing. But that's what we intended. However, we knew that even in accepting that opt-out, that would not be in the best interest of the bill. The best interest of this policy is to do like unemployment insurance and retirement and all of these other benefits that we pay into and benefit from. I know Social Security and Medicare, I'm benefiting from them at this point. It's an insurance and it's a wage replacement when things happen in your life that are wonderful things, but also that are very, very serious things, such as illness and looking after your moms and dads. Does that answer your question?
Fair enough.
It has to be mandatory to work.
That answers my question.
Representative Gator.
Thank you, Mr. Chairman, and thank you, Representative Collins. I'd like to refresh my colleague's memory about the kerfuffle we had with the addition of the of the opt-in, opt-out, and having everything notarized, and it made people crazy.
Yeah.
So do you agree that having it mandatory, that this being something that we hope we never need, but we'll sure be glad when it's available, that it's there when it happens? Do you agree that that's the way to go?
Yes.
Thank you so much.
Other questions? Real questions? Sort of. Thank you very much.
You're very welcome. And thank you again for giving me the privilege of speaking earlier.
Thank you for all your years of service.
I hope this is the last appearance.
At this point, we're going to move into, as the rules require, members of the public who will testify about the bill, either for or against, and we'll then endeavor to go into the lobbyists afterwards. We tend not to get this perfect because we look at the cards and try to figure out, is this a personal lobbyist or not? So once we think we're through all of the public, we'll ask if we've missed any prior to diving into the lobbyists. So, and if a lobbyist is called inadvertently out of this pile, please just let us know. Don't take off your tag. Okay, we will start with, excuse me, Mark McMurphy testifying in favor of the bill.
Thank you, Mr. Chairman, members of the committee. My name's Mark McMurphy. I'm the executive director of White Birch Center in Henniker, New Hampshire, and we do childcare, early learning, before and after school programming, and senior programming. We're a nonprofit, and I support this bill because I think it'll help working families in New Hampshire. When it comes to working families and their children, a child care center is where the rubber meets the road. Not only are we providing a service that they rely on, they literally can't work unless somebody's taking care of their children. But we get to know these families pretty well. Most other businesses wouldn't have the opportunity that we have to get to know families because we're talking about something that's very precious to them, their children. We know more about what's going on in the families than, let's say, typically their dry cleaner. Because childcare is so critical to a working family, and at the same time it's one of their largest expenses that they would incur on a monthly basis, we take extra time with these families, especially those families that are struggling financially, to make sure they can maintain their childcare. And one of the toughest conversations we have is when a family is hit with a sudden or planned loss of income. Planned loss of income is that, you know, there's a period of time when you can start your family. And for a lot of folks, they'll start, let's say, in their 20s or early 30s, and then for the next few years, they're going to start their family. And for a family, that could be a tough time or could affect their decision because there's going to be a loss of income that'll come with that. There could be other reasons for a loss of income, perhaps a loss of a job, or a family member was deployed, or a serious illness in the family. But no matter the case, stress on the families already struggling to make ends meet is palpable in these conversations that we have with them. And they feel like, and we worry, that they're one step away from financial disaster. So I support the Senate Bill 1 because I think it addresses at least two of the causes of stress, a cause of stress and financial instability in working families. At a child care center, no child or family is a statistic. There are no anecdotal stories. Everything that we see and experience is very real, and it happens right in front of us. And I can tell you from my experiences that a lot of families are struggling to make ends meet. This bill offers a real solution to help these families. So I thank you for your time and your consideration. Welcome any questions if anybody has any.
Thank you for your testimony. Thank you very much.
All right, thank you.
It's come to my attention that we actually have Kristen Smith from the Carsey School here, who, as I think you heard Representative Guile say, was very much involved in the actuarial work. So we will call Kristen Smith next. I'd also note that I was going through the stack, and most everybody has 3 minutes or less on their testimony. So if we could try to, and that's not going to apply that to Dr. Smith. But if we could try to stick to 3 minutes or less, and sometimes we get carried away. But we've got limited time today, so thank you very much.
Excellent. Thank you so much for inviting me up to speak. So a couple of weeks ago, you were here speaking about House Bill 712, and so I thought I would come back, and rather than just repeat what I had said previously, I'd like to just take a minute and talk about one of the differences between Senate Bill 1 and House Bill 712. And the main difference that I see is the job protection parameters. So in House Bill 712, if you recall, job protection is available for those who are working in a firm that has 50 or more employees. And Senate Bill 1, I believe, is 20 or more employees. So I just want to talk a little bit about job protection so that you can think about, in light of the differences of the two bills on that measure, what are some of the ramifications of that. So job protection has been shown to be an important factor in terms of workers taking up or participating in the program. If there isn't job protection, workers are reluctant to take leave because they're not sure if they'll have a job to return to. And so studies show that workers are not taking the leave because they fear that they'll lose their job, they'll be demoted, or that they'll be passed over for promotions if they take that leave. And this is particularly true among low-wage workers, and partly because they're less likely to have job-protected leave. The Family and Medical Leave Act, so the FMLA, which is what we have as a system in New Hampshire today, allows for workers to take 12 weeks of leave, paid or unpaid, for these family and medical reasons. But to be eligible for the FMLA, you have to work for an employer with 50 or more employees, and there's some other qualifications of having worked 1,250 hours for that same employer. So low-wage workers typically don't meet those criteria either because they're working for a smaller firm or because they don't have those hours, or they have transitioned from job to job, so they haven't worked at an employer for a full year. There's also research showing that job protection increases maternal employment and wages. So given our low unemployment rate in New Hampshire, paid family medical leave with job protection can be seen as a workforce development aid. Some research that I recently conducted shows that over 90% of New Hampshire residents support including paid job protection in a paid family and medical leave program. And that's research that I will be putting out in probably in April. And then just one piece that you probably know of, but just to make sure, New Hampshire is a small employer state, so a lot of our employers are small businesses. 2017 data from Employment Security shows that 22% of New Hampshire workers were employed in firms with less than 20 employees, and that was representing 82% of firms in New Hampshire. And this is private and public firms, so all firms. In contrast, the House Bill 712 has job protection for the 50 or more employees, the employees who are working at firms with 50 or more employees. And that represents 35% of New Hampshire workers, so you're looking at a difference between the 22% and the 35%. So I just thought that might be something that you all would be interested in learning about. So that's really the gist of why I came today. I'm happy to answer other questions.
Thank you. Questions for Dr. Smith? Seeing none, thank you very much.
Excellent. Two hands to you. Yeah.
And next we would call Alvin C. in opposition to the bill.
Thank you, Mr. Chairman and members of the committee. My name's Alvin C. I live in Loudon, and I'm speaking on representing myself. I'm opposed to SB 1. I feel this bill can provide a disincentive for out-of-state businesses to want to move to New Hampshire. It could also provide an incentive for existing New Hampshire businesses to move out of state, just to keep the costs low, or if they can't move, possibly reduce staff to control added costs. And for a business that's just barely surviving, this may be enough to put them over the edge into insolvency. And for employees that lose their jobs as a result of this bill, instead of gaining a benefit, they lose everything. Businesses can already provide this benefit via private insurance plans if they think it's important to help retain employees. This should be a decision that employers make or in conjunction with employers and employees. And this bill creates another bureaucracy to administer the plan, and if the premiums don't cover the costs of the plan, then the state will have to cover the difference from the general fund. So I think this just isn't quite ready, and shouldn't be. I don't think it's a proper role for government. Also, the bill caused the cost to employers premiums. It's based on a percentage of employees' wage. Therefore, for the rest of the world, it looks like an income tax. And for that, I think I would request that you vote IPL on SB 1. Thank you. I'll answer any questions if there are any.
Thank you very much for your testimony. Do you have written testimony?
Oh, yes, sorry.
You can hand it real quick. And next we call John Lewicki.
Yeah, thank you, Mr. Chairman. Thank you, members of the committee. I was on the other side of the table last year. And in this case, I have spent most of my life working in private industry, primarily in startups, mostly in New Hampshire, some in Massachusetts. And when somebody has a great idea in private industry, they have a word for it. It's a business opportunity. The numbers for this work just the same, whether it's done through the government or whether it's done through private industry. And when somebody has such a good idea in private industry, they don't come to the State House. They go to venture capitalists, they go to insurance companies, they go to banks and other people who can finance it. If this is a viable plan, it doesn't need to be a bill. It doesn't need to be done by the state. It's a simple enough thing. And as the previous gentleman said, it's an income tax. And people in New Hampshire are resistant to that. And that's, I'm sticking to my 1 minute, so that's it. Any questions?
Thank you very much. And I call Ben Chelerski, hope I got that right, in favor of the bill.
Hello, my name is Ben Chelerski. I'm a resident of Nashua, and I'm the chair of the New Hampshire High School Democrats. I hope everyone is aware, New Hampshire is an aging state. More and more high school students are choosing not to come back to New Hampshire after college to start a family or start a business, and that's something that I think must be fixed in the very near future. New Hampshire should be a state that young people from across the country want to move to because they know the schools are great and they want to raise their children here, or they know they can easily start a business and do well in the state. And we need to keep New Hampshire a vibrant and growing economy. Young people should know that regardless of where they work, they should be able to take time off to welcome a new child, to care for a sick relative without having to worry about not being able to pay their bills. And family and medical leave insurance would do just this. It would allow people to spend time with those they love most when it's needed the most, without having to worry about their finances. Family medical leave insurance is what New Hampshire needs to get students to come back to the state after college and allow them to help grow the state's economy by living, working, and spending money in the state. Thank you.
Thank you. Thank you for your testimony. And I'd call Randy Hayes in support of the bill.
Thank you, Mr. Chairman, and members of the committee for the opportunity to speak with you today in support of SB 1 concerning a proposed program of paid family and medical leave. I reside in Canterbury. Some know me as Randy, some know me as Francis. Concerning my background, I'm a retired family doctor who practiced for 35 years in Concord. For many of my patients, I cared for them over 3 or more generations. As my practice aged, I became a certified physician in geriatric medicine. I also served for 25 years as founding chairman of the Concord Hospital Ethics Committee, and for 10 years as a voluntary board member, and 2 years as chair of the Riverbend Community Mental Health Agency. My career as a family doctor has taught me several lessons that convinced me of the critical importance of passing paid family medical leave. From my clinical point of view, please allow me to share 3 specific contributions this bill might provide to each of us and our families. First, serious illness is a family experience. Seriously ill patients and their loved ones suffer less anxiety and receive more effective care when they have the opportunity to go together to doctor's appointments. Such face-to-face discussions about patients' diagnosis, treatment options, and future challenges build trust and mutual understanding among the patient, family, and healthcare providers. This rapport and understanding often leads to reduced time in hospital and in nursing homes, less unnecessary testing, and greater conformity between the health care provided and the core personal values and health goals of the patient. Second, when a patient is hospitalized, I believe one of their most important medicines is the continual presence at bedside of a compassionate, well-informed family member. In order to function as an effective bedside advocate, a family member would usually have to take time away from work. Without such a bill as SB 1, many persons would have to leave their hospitalized loved one alone without a family advocate. And such unattended hospitalized patients statistically are much more prone to anxiety, injuries such as falls, as well as medication errors and other treatment-related injuries. Third, when a newborn adopted child or foster child arrives home, parents do well to spend weeks of unstructured time at home getting to know their new child. Mary spoke to this eloquently. Such a robust nesting and bonding time that would be available to employed adults under this bill can be a powerful means of preventing mental health problems in the child as he or she grows and in other family members. As is often the case, such preventive nurturing is much less expensive than long-term mental health care for the developing child and growing family in the future. So in light of these benefits afforded by SB 1, why would a legislator oppose this bill? In speaking to some members of the legislature, I've learned that many critics of SB 1 believe that the most vital function of legislation is to reduce the size and cost of government and allow the private sector to provide essential services such as paid family medical leave. On the contrary, I believe the most important goal of our legislative process is to help citizens and legislators to work together to create a more effective, fiscally responsible, just, and compassionate society. by providing employed citizens the means to successfully balance the obligations to one's job and to one's family. SB 1 will reduce the demoralizing conflicts our employees and employers currently experience. Ultimately, in my opinion, this bill will prove to be a wise investment that will lead to a healthier citizenry and a healthier economy. Thank you, and I'll be happy to answer any questions.
Seeing none, thank you very much for your testimony.
I'll take your written testimony.
I have 2 copies, then my copier said too much.
And next I would call Alan Reitz in support.
Good morning, Mr. Chairman and members of the committee. Thank you for hearing my testimony. I'm here in support of SB 1, the Family and Medical Leave Bill. I'm Public Relations Director of the Hanover Co-op Food Stores. We have facilities in Hanover, Lebanon, and also in White River Junction, Vermont. Since 1936, members of this consumer cooperative, member owners, citizens, residents, have had a concern for community as well as other locally owned businesses. That statement is actually in our founding document. Today, we're a $72 million food cooperative with stores numbering 4 and 2 auto service centers. We have 213 New Hampshire residents on our workforce as well as Vermonters. We are one of those larger businesses who are able to leverage our size and strength to attract and retain employees. But beyond our mission statement or employment statistics, businesses like ours need a strong local economy. We source from around New Hampshire, from Seabrook to North Woodstock, Bethlehem to Bow. We work with over 100 New Hampshire businesses, many of them are small or tiny, to source about 1,000 products for our business. We have about 5,000 customer transactions a day, so we know what it's like to be a busy retail environment. The overwhelming majority of these businesses, as I've stated, are small. They require a stable workforce. It's critical to that business, it's critical to a state, and yes, it is critical to the Hanover Co-op food stores. I won't go over many of the stories that we've heard. It is reflected in my written testimony that I'll leave with you. But regardless of the scenario, whether it's a transition to a new child or a complicated pregnancy and delivery, cancer, elder care, these are scenarios. And being able to take time off from one's job without risking employment or negatively affecting income to care for a family or oneself is vital. Regardless of the time required, the Hanover Co-op will continue to work to advocate for strong, universal paid family and medical leave in New Hampshire. I encourage you to support it. I feel it's essential for the Granite State small businesses. They are the backbone of the economy. We count on them. I believe this bill can make employee retention affordable and family and medical leave work for New Hampshire. I thank you for your time and consideration.
Full disclosure, I'm one of your member owners.
Well, thank you. Your business is our business. We own a grocery store together.
Thank you for your testimony.
Thank you.
And next I would call Deborah.
Uppermont.
Thank you. Welcome.
Welcome. Thank you for hearing my testimony. My name is Deborah Uppermont. I'm from Ridge, New Hampshire. And I've been hearing a lot of talk about low-wage earning. 2 years ago, my very comfortable middle-class lifestyle almost came to an end. My husband had a heart attack. And it was very surprised for a couple who carries short-term disability insurance to find out it doesn't kick in until 12 weeks later after Family Medical Leave Act. Well, we were lucky because I was working, but I couldn't take time off from my job because I was too new. I work for the government. Fast forward 2 years later, I need major surgery just in January. And we had learned our lesson. We put aside money. I wasn't expecting to be furloughed for 35 days. So we had to cut into some savings. Now we're facing another problem. Without paid medical leave added, we are facing a son who has severe disability, is having life-threatening open heart surgery. Now, we might not qualify for that, but there's other families that I know who are in the same situation. Having the ability not only to come back to your job, but to have some financing available to you keeps us afloat. Our debt is incredible because we have medical bills. We could choose to only have one of us there. But as parents, how do you make that decision when your child is in a life crisis? To say, I will go to work and you handle everything. That's what our family is facing. We will take our vacation time and use it. But the minute it goes over, someone has to go back to work. And I think families in New Hampshire deserve better than that. Also, the workforce that I use to sustain the fact that we both can work is disappearing. We have to develop a workforce that can have paid family leave so I can go to work, so that my worker is interested in coming back to their job. Thank you.
Thank you for testimony. Call Christian College.
And good luck, by the way.
Thank you, Mr. Chairman, members of the committee. I really appreciate the privilege to speak to you today. Before I let you know, my name's, again, Christian Callan. I'm a resident of Wolfboro, New Hampshire. I'm a native son. And before I tell you why I'm appearing here today, I'd just like to respond to some good questions raised by members of the committee. Representative Mackey, you wanted to know on the basis of equity, is it right that an underage worker should pay into a system that they won't be eligible for at that moment? And I think absolutely yes. That's what it means to be a good citizen in a good society. You contribute to the public good, even if you're not yet eligible to receive that same good that you're paying for because you receive other goods. Certainly underage workers here in New Hampshire, I'd imagine the preponderance of them do attend public schools. They're attending schools that were paid for by the taxpayers in the state. So I think that's a good way for citizens to help one another based on their needs at the time. And Representative Seaworth, you mentioned that you asked the question: does it make sense for the state to mandate full participation in a project like this or a program like this? I'm no subject matter expert, but from what I've read, insurance pools, risk pools, they are more efficient the deeper and broader they are. So if we have all workers in the state participating in this pool, I suspect that costs will be lower because efficiencies will be higher because we're all participating. Certainly I invite you and encourage you to check that idea, but that's my understanding. So the reason I'm here today is simply because this is the kind of society I'd like to live in. I'm here to support the bill. I think that we should all sort of pitch in together. I think aside from death and taxes, I think we all know that the other thing that we can expect, without a doubt, is that when our chips are up, someone else's may be down, and vice versa. So we all might find ourselves at one point or another needing the benefit of a program like this. And I think it's only right and neighborly for us to want to contribute to a program like this. And I, for one, would be glad to contribute more than what the sort of earned benefit that's proposed in this bill would require. I think it's the cost of maybe a coffee or 2 or 3 a week. I think that's a very small price to pay for this kind of public good, and I would be glad to contribute more. So again, I'm really just asking you all to, consult with your conscience and your moral compass when you consider the merits of this bill. And that's really all I came here to say. I'm, again, no subject matter expert, but happy to answer any questions any of you might have.
Thank you for your testimony.
My pleasure.
Next I call Bernadette Cameron.
Thank you, Chairman and Committee. I'm here to speak on support of this bill, and I want to relate to you a personal experience that happened to our family. On October 20th, 2006, my husband and I received the phone call that all parents dread. It was the emergency room at St. Vincent Hospital in Manhattan. Our 23-year-old daughter, Molly, had been hit by a car. A fire truck, responding to a call, had collided with a Chevy Suburban, pushing the large SUV onto the sidewalk and into Molly, where she had been walking. When we arrived at the hospital, we found Molly in the intensive care unit. She had a broken jaw, 2 broken legs, a fractured pelvis. Her right arm had multiple fractures that would require immediate surgery to install a metal rod. She was unable to move her right hand due to nerve damage. I stayed with Molly for the week she was at St. Vincent's. My husband had to return to work. After that week, she was transferred to Health South here in Concord for rehab. When she arrived, it was discovered that what was originally thought to be a bad road rash on her lower right leg was actually a 3rd-degree burn from the Suburban's radiator fluid. And she was transferred to Concord Hospital for debridement and skin grafting. Molly stayed at Concord Hospital for a week and at Health South for 6 weeks, receiving intensive physical therapy and occupational therapy. After that, she moved home to Deerfield for another 3 months, going back and forth to Concord for regular doctor visits and continue her therapy. She returned to New York in 2007, and today Molly's a healthy 35-year-old living in New York, where she bikes and runs, and she's regained the use of her right hand. But this is the important thing that happened during this 5-month period. While I was at the hospital in New York with Molly, I received a call telling me to take as much time as I needed to be with Molly. The organization where I worked, the staff were each donating some of their earned time so that I wouldn't lose pay while I was out with Molly. So even though my husband and I tried to keep taking turns as much as possible to be with Molly, this provided the extra time to be with her during the skin grafting, as well as driving her back and forth to her appointments while she was home for those 3 months. Many times I have reflected on how lucky we were. Molly had no internal injuries, she had no brain damage. She was 23, she wasn't 13 or 3. She could understand what was happening. She didn't need someone with her constantly. She was able to be home alone as she recovered. My husband and I both had professional jobs with supportive staff. Many families are not this lucky. Their injuries are worse and their supports are fewer. Families should not have to depend on luck during these times. Events happen in our lives that we have no control over. One thing we can do as a state this year is to at least relieve families as much as possible of the financial burden that comes with such an emergency. Paid family medical leave would do that, and I ask you to support this bill.
Thank you for your testimony. Do you have your written testimony for the file?
Okay.
Thank you.
Thank you.
Okay, next I call Molly Lunn Owen. Okay. Any good luck. Doreen, give us three. How do you do? It's all good.
You're doing great.
My name is Doreen Gildersleeve from Hopkinton, and this is my little 2.5-year-old Abigail. I was a stay-at-home mom for 14 years to raise my family. I went back to work last year at a job that I love. I was able to contribute to household expenses and the New Hampshire economy. My teenage daughter suffers from a debilitating mental illness. She was hospitalized in Boston twice when I was working. I had to use all of my sick and vacation time to spend time with her in the hospital and attend meetings to discuss her care. She finally came home after a 2-week stays. At that point, her school, Parker Academy, felt that her mental health needs were not able to be met at the school, and they kicked her out. I had no care for her while the school district and I scrambled to find a new school. She only had 6 hours of education a week and no respite or other care. During this time, my own health was suffering from the stress. With no sick or vacation time to care for my child, and with the crushing stress of no income, my only choice was to take leave from work. Someone else was hired in my absence, and if I returned, I was going to be transferred to another position. I can't begin to describe the pain that comes with having a hospitalized child, trying to care for my toddler, and caring for an older child that also has an illness. I so badly wanted to work and to help my family financially. If I could have taken paid family leave, an enormous burden would have been lifted from my family. My own health would not have suffered so much. I would have been able to focus on my sick child without my supervisor continuously calling to see when I was coming back to work. Please pass SB 1 for businesses and nonprofits with 15 people or more so that other families won't suffer like mine did. And just as an aside, I opened my own business in November after everything happened with my child and my employer. And as I grow my own business to employees, I would still support paying family leave for my employees so that they wouldn't have to suffer like we did. Does anyone have any questions?
I do.
Oh, sure.
Thank you, and thanks for testifying and bringing your daughter with you.
Thanks.
It's always good to see a broad range of participants, and I'm being facetious. What do you do for a living now? What's your business?
Now I own a transportation company.
For the schools?
No, for cross-country truck driving.
Oh,
So I actually own the company and employ a driver. I also advocate and volunteer for mental health so that children won't suffer with repeat hospitalizations, and I really want them to have the community-based care that they need.
Yeah.
So I participate and volunteer with that.
Congratulations.
Thanks so much.
Thank you for your testimony. Thank you both for your testimony.
Thank you.
And I would call Tracy Hall. Tracy Hall.
I was back in the corner.
Gotcha.
Mr. Chairman, members of the committee, thank you for allowing us all the opportunity to speak to you about this proposed legislation. I'm Tracy Hall, President and CEO of the Greater Nashua Chamber of Commerce. Let me state up front, as I did when I testified before you on HB 712, that while our advocacy committee has reviewed and discussed this bill, as well as its partner bill 712, we have not yet taken a formal position. We do support the concept of a family and medical leave plan. However, we do have significant concerns which we hope you as policymakers will hear and work to address as various FMLI proposals make their way through the House and the Senate. We understand the issues facing employees as they try to balance work and the great joy of welcoming a new child, as well as the particular challenges when either they or a family member falls ill. However, we don't believe this legislation in its current form provides the right workable approach because it fails to take into consideration the reality of its impact on small businesses. There are 3 areas of particular concern to our chamber. We cannot support the funding mechanism proposed in SB1. A mandatory payroll deduction to fund a government program is an income tax, plain and simple. The self-insured option simply shifts that burden to the employer. We also share the concerns others have raised as this proposal makes its way forward through the legislative process regarding the commissioner's ability to increase this tax on his or her own, a responsibility we feel belongs with the legislature. I would further point out that the language in the proposal stating that the commissioner may increase the premiums in a future calendar quarter leaves the timing and amount of any such increases completely unpredictable for businesses and their employees. How do you plan for an increase when you don't know when or by how much it will go up, especially when it could take place within 3 months or less? Second, we believe that employers, not the government, should determine what time off benefits they can and should offer their employees. Today, in most cases, business owners work things out with their employees, as I and many other employers have done when one of our employees needs time. And we heard testimony about employers doing just that earlier today. We do it in a way that's mindful of the unique situation of the employee, but that also takes into consideration the full understanding of the needs of the business itself, so both impacted parties' needs are considered. Again, the legislation is completely silent regarding its impact on business owners and businesses themselves, from the findings right down through the last word. I would also ask you to think about the impact on this for an employee who does not use the benefit. Employers don't have a limitless amount of money to spend on benefits. If they pick up the cost for this, some other benefit is likely to go away. Perhaps a benefit that's actually used by the employee who won't use FMLI, dental or vision or tuition reimbursement or whatever. If the employee is the one who pays, our state policymakers are requiring that they pay for something they will see no benefit from. We urge the committee to make New Hampshire's Family and Medical Leave Insurance Program voluntary on the part of both businesses and employees. And finally, our biggest concern lies with the size of businesses covered by this legislation. I actually had the privilege of working for the House Committee on Education and Labor when the Family and Medical Leave Act was passed in 1993. There was extensive discussion about the impact of FMLA on small businesses, and the decision to exempt employers of fewer than 50 employees was made deliberately and thoughtfully. While we appreciate the move made by the Senate to raise the size of businesses covered from the 15 in the original bill to the Senate-approved 20, we still believe this is too low. I'm not sure how many businesses there are who fall out of the mandate. We did hear a quick statistic from Kristen, but there are still tens of thousands of small businesses across the state facing this mandated expense. Should the committee choose to mandate this program for businesses, which we do not support, I would strongly urge the committee to amend the legislation to align it in line with the 50 employees or more level set in FMLA. In closing, I would urge the committee to take the very real concerns of our chamber and its members into consideration and adjust their proposal accordingly, so both our nearly 300,000 small business employees and their employers in New Hampshire can be treated equitably. Thank you for allowing me to share our concerns with you, and I'd be happy to answer any questions that you may have. And I wrote all over this, but Representative Schmidt, I will email you a clean copy, if you will.
Thank you. Seeing no questions, thank you for your
Thank you very
testimony.
much.
And the next call, Thaddeus Ashcliffe.
My name is Thaddeus Ashcliffe. I am from Henniker, New Hampshire, and I wanted to come here to voice my support of the Senate bill that my senator brought forth. Pretty awesome on him. There are a few concerns that I wanted to address that have been raised. This, as everyone knows, is something people have been working for a long time. This is a serious need that has not been addressed. And the best way to put it is, this is a market failure. This is a portion of risk where people's families, due to the inevitable outcomes of life, whether it's a new child or when you or someone you know gets sick, that happens. And for most families, this can be disastrous. And one of the most important differences with this bill versus the competing bill is the protection for workers. So that way, when you have a new child or someone in your family gets sick, you can be there for them. Or you don't have to make the choice. Do I take care of a family member, or do I suffer financially, or, most likely, try to do both and fail? This year, my mom was very sick, didn't quite know what it was, and I had to be there to take care of her. We found out stage 4 cancer. After receiving surgery, her life was saved, but it's not over. And I'm not unique in this circumstance. I never thought I would ever have to worry. I'm fairly young. The idea of health insurance is a benefit I've never had from a job I've worked in. But when a family member got sick, I took all the time off I need. I didn't look for any work until she was able to take care of herself. Only then did I re-enter the job market. And my experience is not unique, but I'm mentioning that not because, well, to illustrate that this is a choice, and often families are already in a desperate financial situation when someone has to take time off from work. And it's compounded when it's a medical crisis. And it can be disastrous when you do not have the financial means to take time off, or when, due to medical necessity, you do, and the family finances suffer dramatically. I think this is a clear necessity for a bill of this sort, and the protection for workers who re-enter the job market not only lets people endure medical crises with less worry, less stress, less financial hardship. It means that you can re-enter the job market, you can keep your job, the business doesn't have to rehire or find someone else. It's less disruptive to the entire state for something like this. And I think there's a clear need. This bill seems to be the best one to address that aspect, and it is why I'm supporting this bill. So, thank you.
Thank you for testifying. At this point, I believe we've covered all the members of the public. Am I wrong about that? It's the first time I've ever been right. Okay, so we will go to the lobbyists, and first we call Amanda Sears.
I have some testimony in folder from others who, thank you. Hello, I was able to testify in favor of HB 712 a couple of weeks ago, so I will save the committee from repetition. However, there are a couple of things in particular I wanted to address. As you've heard, one of the key differences between this bill and HB 712 revolves around job protection. We strongly support both of these bills. We see, typically, oftentimes job protection and financial security are dealt with as two pieces of policymaking with regards to family and medical leave. And so the Family Medical Leave Act is purely about job protection. Family and medical leave insurance, the insurance piece itself is about financial security. So both HB 712 and SB 1 would ensure financial security to working people who need this kind of benefit to take time out from work to care for a loved one. The addition in this bill of additional job security is a strong benefit to people to ensure that they keep their job when they need it. I've heard from the AARP and testified previously that they've had over 8 and 10 people that they surveyed, residents over 40, say that they support ensuring employers cannot fire employees for taking time off for family caregiving. So I know that there is a great deal of support for that. I think that both bills have anti-retaliation, anti-discrimination built into them so that people wouldn't be retaliated against for taking this leave. But the additional job protection is a strong additional benefit for people. Thank you very much.
Any questions? Thank you.
Thank you.
And next call, David Jubei.
Thank you, Mr. Chair, members of the committee. For the record, my name is Dave Jubei. I'm Senior Vice President with the Business and Industry Association. We are here today in opposition to the bill. I'd like to first of all explain, because this is my first time before the committee, we did not testify on House Bill 712, which is a similar bill. And the reason why was our association was still vetting both of the proposals at the time that hearing took place. We spent a lot of time discussing with advocates like Fernanda Sears and also the prime sponsors of the House and Senate bill, inviting them into our shop to meet with our members and discuss the bills, and want to do our best to evaluate both proposals before commenting on them publicly. That work has taken place, and our executive board met last Thursday and voted that they could not support either bill because of one key feature. There are a lot of issues that we could identify that I think are problematic, but I also think they're workable, and that advocates of the business community could come to consensus. But the one thing that's missing, it was a part of the effort last year that, for those of you who were here, remember BIA was neutral on last year's bill, was some type of opt-out or opt-in feature. The fact that this is a mandatory program, that employers don't have the discretion about whether to participate in, and employees don't have the discretion about whether to participate in, is very problematic for our association. That was a non-negotiable that we just couldn't find our way around. So I would urge the committee, if they are looking for the participation and support of the business community on a benefit that we recognize the value of, to please consider adding some type of component within this that gives businesses, employers, or employees the ability to decide whether or not they should participate. Thank you, Mr. Chair. I'd be happy to answer any questions.
Do you recollect the actuarial difficulties that occurred when the opt-in, opt-out provision came last time?
I do.
Do you see how that could be avoided if we put it in this year?
Without commenting on the governor's proposal, which is not what this hearing is about, he has come up with a proposal that would establish some type of program that employers could then choose whether or not they want to participate in. I don't have the actuarial background to to offer other suggestions on how that could be incorporated. I do acknowledge that that created complications, and frankly, the opt-out provision was somewhat clumsy and difficult to administer, but at least it was there.
Seeing no other questions?
Thank you.
And I would call Todd Fahey.
I'm sorry, Mr. Fahey's will be here in a second, so if we could just wait.
We can move on. Call Mike Padmore.
Thank you, Mr. Chairman. Members of the committee, my name is Mike Padmore. I'm the Director of Advocacy at the New Hampshire Medical Society, and I'm here to speak in support of SB1. I passed around a packet of about 12 stories from different physicians who were not able to attend the hearing today. They range from a variety of different practices. Actually, one of the stories is Dr. Hayes, who already came and spoke. I want to repeat some of the points that he had made. I think he was able to articulate the impact that this bill can have on families, especially young families. But one person that I did want to point out that's in your packet, it's the first page, is Dr. Seddon Savage. She is the current chair of the opioid task force on the Governor's Commission on Alcohol and Other Drugs. She's also the co-chair of the healthcare task force. She is an expert in addiction and pain medicine. And I think that she was able to articulate in her testimony how this piece of legislation, how this paid through the program will really impact folks within our state who are suffering from substance use disorder. And you know, I'll leave that to her testimony to really kind of go into some of the details, but to hit on some of the high points of it, you know, I think that in my conversations with her about this, the thing that she really wanted me to emphasize was that the biggest barrier for people that are suffering from substance use disorder is that they are left with a choice on whether to seek treatment or to stay in their job. It is a choice that they are actively making and trying to figure out how they either can take the time to afford to take that time off to seek treatment, or in many cases, a lot of them make the decision to simply not access treatment because they can't afford to take that time off from work. I think that's a very real thing that this piece of legislation addresses, and that it can help. I think another piece of this too is, and this is something that we really talked about, is that recognizing that in New Hampshire we have a lack of treatment beds. It is very difficult for folks that are suffering from substance use disorder to find inpatient treatment. Outpatient treatment is a very critical component of someone's recovery. And outpatient treatment usually comes from family members. And that's something that this bill does. It allows for family members to take that time off as well to care for their children, their parents, whoever that might be, who is suffering from that illness. So I would really encourage you to take some time to read her testimony. If folks have questions for her or for any of the other folks that are in your packet, please let me know. I'm happy to coordinate with the chair to coordinate any conversations that you might have. And with that, I'm happy to answer any questions.
I actually have Mr. Gordon.
Thank you, Mr. Chairman. Thank you for taking my question. So, do you believe that the family medical leave, because family members would be able to provide outpatient care, would have a significant impact on the cost of medical insurance, because those costs currently may be incumbent upon the paid medical care providers that are in turn reimbursed by health insurance?
I don't know if I can answer your question. I'll be totally honest with you. I don't know if I can talk about the entire ramifications that this program might have on the health insurance market or whatever that might be. I'm happy to make a note of that and to follow up with you. I just don't know if I'm in a position to answer that question right now.
Thank you.
Thank you, Mr. Chairman, and thanks for coming out to testify. I just had one question. When you talked about these people that are being treated at home as it relates to opioid addiction, this program gives 12 weeks of family medical leave. But from what I understand, talking to physicians and mental health workers, is to kick opioid addiction, it's a 3-year treatment. So how do we, I mean, it doesn't seem that what you're saying is solving the problem, it's just a Band-Aid?
I don't want to say that this program is going to solve all the challenges that we have in the state when it comes to the opioid crisis. I don't want that to be the takeaway from this. I do think, and then in speaking with Dr. Savage about this program, I think that and I want to try to represent her perspective as much as I can. I think that from her perspective, this is something that helps. It is not going to solve this problem, but I think that in recognizing that it is challenging for folks to find inpatient treatment, having some sort of a support network, and not everyone has that support network, but for the folks that do have some sort of a support network of folks that might be able to take some time off, even if it's just a week or two, just to be able to care for that person and be there for them, I think it does go a long way for folks in their recovery.
Thank you very much, sir.
Thank you, Mr. Chairman. Thank you for taking the question. Isn't it better to have someone get into treatment, even if it's just 12 weeks, those first 12 weeks I imagine are critical, rather than to have the person continuing to use the drug, risking overdose, disease, and driving to and fro?
My understanding is that the best way, or the best use of this program, and the best way to care for some of these folks who do have substance use disorders is to be able to try and get folks into inpatient care. Again, I don't want to suggest that this is going to address any of the challenges that we have with our capacity for handling that, but I think that it does at least help solve the problem of making it a little bit easier on that person to make that decision on whether or not to take that time off from work to be able to access inpatient care.
Thank you.
Thank you very much.
Thank you.
Next I call Mr. Bruce Berkey.
Thank you, Mr. Chairman and members of the committee. For your record, my name is Bruce Berkey, and I'm here this afternoon on behalf of 4 different clients that are in opposition to Senate Bill 1. And they are the National Federation of Independent Business, the New England Convenience Stores and Energy Marketers Association, the Associated Builders and Contractors of New Hampshire, and the Electrical Contractors Business Association. NFIB represents over 1,400 small businesses in the state, and they're opposed to the bill. They do applaud the advocates for the efforts made to discuss this issue. We just don't think it's right for prime time right now. The primary flaw of SB 1 is the fact that it tells the small business person how to operate their business. You've heard me say that before. It's a mandate. It's an intrusion into the business operations of a small business. If SB 1 is enacted, what is the next mandate? And when will the mandates end? Beyond the mandate, there are concerns about employer-employee relationships if this bill were to go into effect. Primarily looking at the opt-out, opt-in process. The bill says an employer may opt in or opt out of the program when it begins. This allows the employer to provide the bill allows the employer to provide a comparable or equivalent plan to the state's plan. But nowhere in the bill does it specifically define what is equivalent. And so this omission is going to lead to disputes as to what is equivalent, perhaps with the Department of Employment Security, or perhaps with the employee. And so it creates that tension within the workplace. We also have concerns about the original administrative costs to enact Senate Bill 1 or House Bill 712, the $15 to $18 million to establish the program. where those dollars are coming from. There's been some talk that they would be borrowed from the general fund and paid back over time. But what happens when there's no money to pay that back? Who does the state turn to? The small business community? Sustainability is another concern. We've heard about the development of this issue over the last several years, and during those debates, there was proposals to decrease the benefit by 50%, increase the cost by 34%. This does not create confidence in the small business community. And this can lead to problems between employers and employees. And if the program fails, who will be responsible to pay for its collapse? There are only two sources, the employer or the employee. Well, imagine if the employee is asked to make up the shortfall through a higher premium or shorter benefits. If the employee is asked to pay more or get less, the employee says, that's not what I signed up for. That's not what this was advertised as. And then second, never in the history of New Hampshire has an employee been asked asked or required to make up a state government shortfall. And the reason for that is because we do not have a state income tax. Now imagine if the employer is asked to make up the shortfall. What are the consequences? No raises for employees? Fewer hours for employees? No additional hires? The list goes on. Mr. Chairman, members of the committee, I just don't think this bill is ready. While we're not prepared to endorse any other proposal, we do believe that a voluntary program can be worked on and can be developed into something that is more amenable to the small business community here in New Hampshire. We ask you to consider that. We thank you for your consideration today, and we urge you to find Senate Bill 1 in expedient for legislation.
Thank you for your testimony. Next, we would call Kate Berry.
Mr. Chairman, honorable members of the committee, my name is Jacob Berry. I'm the Vice President of Policy at New Futures. We are a nonpartisan, nonprofit health policy and advocacy organization. We've worked for more than 20 years to address alcohol and other drug issues here in our state. Now, as New Hampshire's designated Kids Count organization, we advocate for data-based policies in support of Granite State children and families. In addition to written testimony from New Futures, I have submitted testimony on behalf of Addiction Recovery Services, a outpatient substance treatment service down in Salem, as well as One Sky Community Services, a developmental disability area agency out in Portsmouth. We all stand strongly behind SB1. We believe that the paid family medical leave program is essential to the health and well-being of some of our most vulnerable families, including those experiencing developmental disabilities and those combating substance misuse and other behavioral health issues. I'm going to skip most of my testimony here. Mr. Padmore from Medical Society really addressed a lot of what I was going to say. But needless to say, what we do know is that of a 2014 federal survey, there are about 10% of New Hampshire residents have experienced drug or alcohol dependency within 3 years of that survey. We expect those numbers have increased since. As Mr. Padmore alluded to, lack of a paid leave program has really been one of the great obstacles for many of these individuals to access the treatment services they need. Further, we know that as we continue to battle the opioid epidemic, the number of children who have been placed in out-of-home placements with relatives has increased by 10% between 2012 and 2016. These are families, these are children who would benefit significantly from a paid family leave program. Without a paid leave program, it is not only the individuals who are battling substance misuse who are impacted, but it's their children. These are children who have experienced toxic stress and adverse childhood experiences in the home. Without their parents there to be able to access the treatment services they need, or without their caretakers, being grandparents or other family members, able to access paid family leave, they're really lacking that stabilizing factor within the household. Will continue to experience these kind of toxic stress, which can lead to impaired brain development, which will impact their health throughout the rest of their life. So I would say an investment at this point in paid family leave is really an investment in our children, and will save us costs over the long run. And if I may, I'd love to address some of the questions that had come up earlier. Representative Flanagan had asked about certainly the length of an effective treatment program. Certainly, we absolutely know that the length of treatment program can vary based on the needs, whether it's inpatient or intensive outpatient, can go from 28 days, 12 weeks. But we do know that those first few weeks of any treatment program are absolutely the most critical. So to be able to provide a period of financial security through a paid family leave program to an individual or to a family member during those initial core period where they're receiving treatment is absolutely critical to their long-term recovery. There was also a question that had come up regarding outpatient treatment and the family's role. I just want to clarify that though the family does absolutely play a critical role in supporting somebody who is receiving outpatient treatment for substance use disorder, they are not the ones who are administering the treatment or administering the family therapy session, so therefore they would not themselves be eligible for insurance reimbursement, but they are certainly participating and playing an absolutely critical role in that in those support services for the individual. And with that, I'm very glad to take any other questions.
Thank you, Mr. Chairman. Thank you for taking my question. I apparently didn't make my question clear. What I was asking the previous fellow was whether he thought there would be a decrease in the utilization of some of the outpatient care provided because caregivers, family members would be able to provide care. Maybe that would offset some of the medical costs for patients.
I apologize, I misunderstood.
And that was a question, yes or no?
I understand, I apologize, I misunderstood that question. My take on that question, I don't know that there would be a decrease in the people needing to access those services, but I would say that the success rates of those treatment services are greatly enhanced the more the family is able to participate and provide that support.
Thank you.
Thank you for your testimony. Three more cards. Is Scott Pagey available now?
Good afternoon, Mr. Chairman, members of the committee. Please forgive my tardy appeal here. I have we have submitted testimony. Have you received our testimony yet, the written testimony?
I've received a lot of
I-
testimony. So I
All right, well,
can't say.
here it is with 20 copies, Mr. Chairman. Can I approach?
Yes. Another joke.
I know, just an old habit, sorry. So I am Todd Fahey, the State Director of AARP. Good morning, afternoon to all of you. I appeared a few weeks ago to testify to the House, companion House bill on this, and appear again today respectfully. I'll limit my comments since we've met before and we've heard them. We have about 230,000 members in New Hampshire and 38 million members nationwide. Recently, we conducted a survey of 1,200 people in New Hampshire, ages 40 and above. And they were AARP members, non-AARP members, Democrats, Republicans, and from every end of the spectrum. And so, and with every bill, particularly a bill like this, we have situations of what the benefits and protections of the bill are, what the funding mechanism is, and I understand that both of those things are being hotly considered, and then the class to be benefited. So I'm just going to share with you some data about the class to be benefited. Essentially, in New Hampshire, there's about 173,000 family caregivers, and they provide care for spouses and children and loved ones, and they do so without cost to the system. If you were to quantify the contributions of those people, it would be about $2.3 billion of uncompensated care. So in our view, this is one way to give these people an ability to do what they do out of love, affection, duty, whatever, and give them a little bit of a lift while at the same time letting them continue to be productive members of our state. So the highlights of this survey are as follows, and I've given you an attachment to my testimony. 7 in 10 residents over 40 who are current or former family caregivers have been employed at some point while providing care to their older parents, spouses, or other loved ones. 3 in 4 of these say caregivers have had to make at least one modification to their work schedule to provide care for the loved ones that they're caring for. 74% of those we surveyed had to either modify their normal work schedule, 69% of them, take a leave of absence to provide care, 25%, give up work entirely to provide care, 20%, or go from full-time to part-time work to provide care, 15%. I share those numbers with you because, as this committee well knows, in a time of low unemployment, historically low unemployment, about 2.5%, I guess it varies obviously by month in New Hampshire, we really need to make sure we can keep all people in the workforce for the benefit of the business community and for those people who need to work themselves. Those people, 67% of them reported feeling stressed trying to balance job and family. So the majority of residents that we surveyed who are over 40 either strongly supported or somewhat supported proposals to help working family caregivers care for their loved ones and to continue work. In addition, 8 in 10 40-plus residents supported ensuring that employers cannot fire employees for taking time off for family caregiving, and support is high across political parties for that proposition. Republicans 79%, Independents 84%, Democrats 86%. 7 in 10 support a requirement that employers provide some paid leave to employees that can be used for family caregiving purposes, and support for that proposition is likewise high across political parties. Republicans at 65%, Independents at 78%, and Democrats at 84%. So as far as the face, who the quintessential caregiver is, or the prototypical caregiver in New Hampshire, it's a woman, 58%, and they're about 57 years of age or older, and they're caring for a parent who is around 81 years of age. Many of these folks are still currently employed full or part-time, 59% of them, and nearly 4 in 10 are also caring for a child 18 or under or 19 or older who live with them. So it's just another way of saying and amplifying the testimony you've heard that there is an acute need to give some lift to caregivers. The extent of that lift and the way you fund it is certainly within the purview of the legislature. But we're just here to testify as to what the preferences that we have heard in recent data on the subject support. So with that, I'll conclude my comments recognizing that I was tardy, and beyond my tardiness, I stand between you and lunch. It's not a place I'd like to be, but nonetheless, I find myself here, and I'll take questions, Mr. Chairman.
Seeing no questions, thank you for your testimony.
Thank you very much.
And then the next I call Heather Carroll.
Good afternoon, Chairman and members. I will make my comments very brief. Going after Todd makes my job a lot easier. So my name is Heather Carroll. I live in New Boston, New Hampshire, and I represent the Alzheimer's Association in the 24,000 diagnosed case of Alzheimer's here in New Hampshire. I just want to point out that our caregivers are providing 76 million hours of unpaid care already to ensure that their loved ones are safe, happy, and healthy. 2 out of 3 of our family caregivers are still in the workforce. We looked and we asked our constituents exactly what would help, and paid family leave came up over and over again. It's the thought process of not having to make some difficult choices. And Alzheimer's disease also affects the entire family. If paid family medical leave were an option, it would be a lift to the stressors that our folks are going through. Choosing between early retirement and from a well-paying job to care for a spouse with Lewy bodies, potentially choosing between being able to assist your dad who has Alzheimer's disease and has broken a hip and is on one-to-one at the hospital,
choosing to be able to help your mom transition into her home after leaving her home of 52 years and having to go into a memory unit, and making sure that that is as smooth as possible. And also, you know, the thought process of losing your job because your employer knows that you're caring for a very difficult, complex disease. And if you lose your job, insurance, you might be the insurance holder, you could potentially lose your insurance, and the cost of those medications could jump substantially. We also want to make sure that it covers the other end of the spectrum and the 46-year-old who's just been diagnosed with early stage dementia and has an 11-year-old and a 9-year-old. So in conclusion, I'll say that it affects the entire family. In the throes of a life-changing diagnosis, looking for private insurance that you may or may not qualify for because you have the most expensive disease process out there, shouldn't be, it's not even on the radar for our folks. And often, mild cognitive impairment, or MCI, is a disqualifier for those insurance policies. We just want to be able to lift the weight. Having resources readily available through your employer that you trust could go a long way for helping New Hampshire families continue out through the aging continuum and economically supportive of the workforce no matter how old you are. We ask that you support the bill, and that's in conclusion of my comments.
See no questions. Thank you very much. And our last card is from J.J. Smith.
Thank you, Mr. Chair.
Thank you for your patience.
Yeah, I don't have an orange badge because I'm entirely voluntary. I'm the lead advocate for New Hampshire Public Health Association. I wrote down 1 minute because I'm actually just going to give a personal reflection. That's what the distributed handouts speak for the Public Health Association. I'm a retired physician. The first 15 plus years of my career, I was an employer. Maximum employees 4. I can't imagine on the idea that we could do this without it being mandatory, that I could find or could have found as an employer that it would have been affordable, especially after I had had a staff of 3 who had all had major problems. Nurse who'd been in the hospital for well over a week, and so she was out for a couple of weeks. A receptionist whose daughter had a major issue, and a business manager who had her own issues and was repeatedly out. And I can't imagine that I would have been able to find affordable insurance under a voluntary company. And, you know, I took care of my employees pretty well as I could, but it was difficult. And I didn't make a lot of money as a result during those times. But that's the way it goes. But there are employers who won't do it unless it's mandatory. But that's the same for unemployment insurance. It's the same for workman's comp. It's the same for lots of things. Employers will figure out how to do it unless they're so marginal that they shouldn't have been in business in the first place. All I have to say.
Thank you for your testimony. And next time, Dr. Smith, if you could let us know, we'll put you before the
well, you see, that's never been clear. When people say, you know, are you representing? Well, yes, I am.
Fair enough. Thank you for your testimony. Do we have more? I think we can close the hearing. We've got some more testimony. Oh.
Then one more speaker.
Just under the wire.
Thank you. Yes, okay, here I am. I think I've spoken to some of you before on the minimum wage bill last week or 2 weeks ago. And I am back again today to talk about family medical, paid medical leave. I know I said before in my story that I've lived here for 50 years and had quite a varied background here as far as working is concerned and as far as any kind of employee benefits are concerned.
Could you identify yourself?
Yeah,
I'm
please,
Heather
thank
Stockwell.
you.
Sorry. I'm so sorry.
Representing?
Rights and Democracy.
Thank you again.
Here we go. So I grew up in a small town in the Monadnock region. I came from a good family. My father served as a state rep for 8 terms and worked for Yankee Magazine and was also the commissioner of the New Hampshire Highland Games at Blue Mountain. My mom was a musician, a teacher, a tutor, chef, and a restaurant owner. I personally struggled to find a good paying job or a job with health care benefits, let alone any paid family medical leave program. And that's been the reality of, for many New Hampshire residents for far too long. It wasn't until this last month that I discovered what it was like to be able to take some personal time off for a family medical emergency. A year ago when I started my job with Rights and Democracy, where I get paid a salary which is a living wage, and I get health care benefits for myself. Upon reflection, after taking this time off, I began to realize that this had never happened to me before. And I'm truly grateful to be in the position I am now and working with a team of folks that care about the people of the state and the nation. Unfortunately, that is not the position for many Granite Staters right now, currently. In a recent survey that I coordinated for Rights and Democracy, over 1,000 people were surveyed in 2018, and 80% said they were very concerned about affordable access to health care, and over 70% were concerned about having a good paying job. We know that most Americans cannot afford a $400 medical emergency, or any emergency for that matter, and the people of New Hampshire are part of that equation and deserve better. I can recall several times that paid family medical leave insurance would have been beneficial as a worker in New Hampshire, and most of these have been in the last 20 years. So from the time I was 30 to 50 approximately. The birth of my son in '01. I had to quit my job because they would not hold it for me. And then my husband was not allowed to take time off to support me. In '02, my father passed away while he was running for re-election very suddenly. We all could have used a break at that point to deal with the aftermath of what my family went through. The death of my husband's father in '09. The death of when I could have supported my husband's family. The death of my mother in '15, when I was only able to visit her on weekends at rehab centers until the day of her death. And then just recently, my husband's medical emergency, which began on 1/14/19 and continued until just a few short weeks ago. Some of the expenses that are generally not considered when I hear folks talking about this issue are other expenses that we encumber when we're supporting in that role. One were gas expenses going to and from the hospital. Another is lodging sometimes if the hospital is a long distance away from your home. Food. Buying food every day in the hospital instead of preparing it yourself at home adds up very quickly. Prescriptions and other medicines after being released from the hospital. And non-prescription items like bandages, tape, etc. My personal estimate for expenses such as these for a week totaled $400 to $500, which is also the amount that most Americans can't afford. And this isn't even including any of the care that my husband received. So I'm here today in support of paid family medical leave, and I hope that future generations of the state will come to know the humanity and importance of being able to be with their loved ones in tough times when the most important place for them to be is with their families. Thank you.
Thank you, Rita. Have you passed out all of the written testimony that needs to be for people leave? But with that, I will close the hearing on SB 1, and thank you everybody for being here.